The second leading cause of death worldwide after heart disease, claiming 9.6 million people in 2018 alone. A group of more than 100 diseases involving abnormal growth of cells. The scourge, cancer. Some cells divide uncontrollably faster and some at a slower rate. What exactly is this infirmity?
So cancer refers to an abnormal proliferation of growth that has the ability to grow abnormally within the tissue of origin, invade surrounding tissues, spread to distant organs, and eventually kill the host. So most people, where the fear is the killing the host. So some people confuse cancer with just tumors. A tumor refers to an abnormal proliferation of growth, full stop. Whilst cancer has got the ability to invade surrounding tissues, what this means is it can actually eat up the surrounding tissues, then spread to distant organs. That is what we call metastasis. So it is started on a finger, it goes on to the armpit, it goes to the lungs, it goes to the brain, to the bones. That's what cancer does. But if you've got a simple wart, which is just a tumor, it won't do that. But the biggest part is the ability to actually kill the host or the patient.
Symptoms of cancer vary depending on the type or form of cancer. Dr. Mba explores the types.
Cancers are classified in many different ways, but the common one is by the site of origin. If a cancer or a growth has started in the breast, then it's simply called breast cancer. If it started on the skin, skin cancer. In the brain, brain cancer. So medicine is quite simple. However, when we then further analyze the cancers, when you look at breast cancer, it's not just one disease entity. Under that umbrella, you've got many types of cancers there, depending on the tissue of origin. So if it has begun in the lobules, which are like the grape-like part of the breast, which form milk, then it's called lobular cancer. If it started in the ducts, which are the channels between the lobules and the nipple, it's called ductal carcinoma. If it started in the supporting structures, be it the muscle, the fat, then it's called a sarcoma. And they all behave differently. They will all present in slightly different ways. Some are more aggressive than the others. Some are more responsive to treatment. Some, once you get the diagnosis, you know that you are faced with a horrible outcome.
Cancer is a major health problem worldwide, with 1 in 5 men and 1 in 6 women developing the cancer. Lung and breast cancer are the commonest cancers globally. Let's narrow down to Zimbabwe's statistics.
So the commonest cancers in Zimbabwe amongst women, we're looking at cervical cancer, followed by breast cancer. Then comes non-Hodgkin's lymphoma, Kaposi sarcoma, and then we've got all the other cancers coming as esophageal cancer, liver cancer. Amongst men, the commonest cancer is prostate cancer. Coming after that is non-Hodgkin's lymphoma, Kaposi sarcoma, liver cancer, esophageal cancer. Then we've got the colorectal cancers. The importance of this question, I really like the question you asked, is that when you look at the epidemiology of cancers in Zimbabwe, number 1 amongst women is cervical, then breast, number 2. Yet worldwide, the leading cancer amongst women is breast. After that, you get lung cancer. After that, you get colorectal cancers. These other cancers I mentioned don't even appear in the top 5 of our cancers locally. The ones which are common amongst women locally, all of the ones I mentioned, excluding breast, are related to HIV. Cervical cancer is related to HIV infection. Non-Hodgkin's lymphoma related to HIV infection. Kaposi sarcoma, HIV infection. Then we go to the side of the men. Prostate cancer is the commonest cancer amongst men worldwide. So it is also common here in Zimbabwe, fair and square. But all the other cancers coming after that, we've got Kaposi, non-Hodgkin's lymphoma, esophageal cancers. All of them have got some link with HIV infection. And yet, when you look at worldwide statistics, the commonest cancers amongst men will be prostate, then lung, then colorectal cancers. So HIV has got a big role to play when it comes to the distribution of the cancers in Zimbabwe.
There is need for cancer sensitization in developing countries, conducting educational campaigns and services. This will help allay stigma, conscientize people on the need for early testing, and raise funds for research purposes. In Zimbabwe, cervical cancer is the commonest cancer amongst women. But are the women alert to this?
When you look at developed countries, most women who present with cervical cancer are actually asymptomatic. They are diagnosed during screening tests, usually the pap smear. In our setting, we've got a small percentage of women. It is beginning to slowly increase because of awareness, who are diagnosed at those early stages. Sadly, most women present when they have a symptom or a sign which the doctor finds. So by the time that a woman has got a symptom because of cancer, it is a sign or an issue to ask the oncologist, because it means that by that time they're at an advanced stage. I would encourage people to come in when they don't have signs and go for screening. However, for those who don't have screening tests done, if you find that you've got what we call post-coital bleeding, that is bleeding after sexual intercourse with your partner, it means you need to get checked. That's a symptom. Other symptoms include just bleeding, intermenstrual bleeding, or postmenopausal bleeding for those women who are no longer going for their menstrual periods. And then we've got lower backache, lower abdominal pain. Some even come with very advanced disease, which is now affecting other organs. So they can come in with kidney failure, they can come in with metastasis even to the lungs and to the bones. All these are the spectrum of symptoms we see amongst women.
Any family which finds itself in this cancer predicament, all hopes will be in India. One wonders whether these hopes are justified.
Zimbabwe is equipped to treat cancer. I do appreciate fully that we have been facing serious socioeconomic and health challenges in this country. But putting that aside, the expertise to treat cancer is available. The resources regard some of the machines. We may need more in numbers, yes, but they're actually available. The drugs can easily be imported and be used in this country. So when we are looking specifically, for example, at cervical cancer, a woman can get care from the time of diagnosis up until she has received full treatment in this country without having to go to any other country.
Walking into a cancer clinic can be intimidating. Cancer takes a heavy toll on your psychology and everyone else around you.
I was diagnosed with cancer in 1998 when I was 14. It started on the left leg, on the knee. My leg was just swelling, and that is when I told my parents that I wasn't feeling well, and I was given tablets, painkillers. So each time the pain would come, I would go for the painkillers and the pain would go. So I took painkillers, I think, for about 2 weeks. The third week, the pain was just becoming severe, such that I couldn't hold it anymore. So I complained again about the pain. And then after a month, my parents took me to the doctor. So when we visited the doctor, he took an X-ray, and that is when they discovered that there was a growth on the bone. And they said we have to take a sample, so we have to operate for us to take the sample. The sample will be taken to the lab. That is when we are going to find out the cause of the growth, because they couldn't tell what was causing the growth before taking the samples for testing. So when the samples were taken for testing, the results came, and my father was told that I had developed osteogenic sarcoma, that's a bone marrow cancer. And he was supposed to break the news to me, but he didn't tell me for 2 weeks. He kept the news to himself. Maybe he was afraid. He was also still in disbelief. I don't know what were his reasons. So 2 weeks later, he told my mother about the news. He gave my mother the results and just advised my mother that she had to take me to the hospital. The doctors were waiting for me. So went to the hospital. My mother couldn't break the news to me as well. She took me to the hospital. I didn't know what was happening. So when I went there, I was referred to an orthosurgeon. The orthosurgeon took me and explained that you had developed cancer. And I didn't know anything about cancer then. I was too young. And something that you have never come across, you only got to know of it when it has affected you. So that is when I was explained that it's, the type of cancer spreads so fast if you don't get an amputation. And on hearing the news, it was so scary. I was devastated. I was shocked actually with the news. I couldn't believe it. And I was asking myself, but why me?
Cancer is now one of the biggest, if not the biggest, scourge facing our people today. So there was a time 10, 20 years back when people would say, you know what, I've never seen anybody with cancer, I've never heard of anybody with cancer. But right now, if everybody is to introspect, they have heard of somebody who has had cancer, be it a friend, a friend's friend, a cousin, a relative, or even themselves. So cancer is a reality. And unfortunately, people are very fearful. But I encourage people out there to seek knowledge and go and get tested. Know about your family history, because some cancers follow family trees. Know about your HIV status, because some cancers are related to a suppressed immune system, like we highlighted with cervical cancer, non-Hodgkin's lymphoma, Kaposi sarcoma.
If someone has cervical cancer, it does not mean that person is HIV positive, but rather, HIV acts as a catalyst of cancer.
It does not mean that every patient out there who has cervical cancer is HIV positive. No. But we are saying being HIV positive increases the risk of getting some of these cancers. And the reason being, HIV will suppress the immune system, thereby reducing the chances of the normal immune system or the normal fighting cells of the body to pick up abnormal cancerous cells. One, which is called immunosurveillance, it becomes suppressed. And then it reduces the chances of the body dealing with those abnormal cells, which is clearing them out. So essentially, HIV in itself will not cause a cancer directly, but it is permissive. It is a promoter of abnormal cancerous cells having a field day in a patient's body. So I encourage every HIV positive patient to go for cancer screening. And just inquire from your local or nearest health clinic more about these cancers, particularly if it's a female patient. Cervical cancer is real, and it is very sad that cervical cancer is the cancer which is causing the highest mortality and morbidity amongst our people. And yet, it is one of the cancers in the world which can be screened for, which can be prevented, and which can be treated easily. So for 2020, I would say, may every woman out there say, I will not die of cervical cancer.
And no myths are associated.
No, unfortunately, I didn't get any professional counseling, except that the information I just got from the orthosurgeon was just you need to get amputated before it spreads. So at home, there were relatives, they were coming, so they were advising me to, some were saying, no, you have been bewitched, you can't go for amputation. So they were trying to tell my mother that you have to go to Chipinge, there is a Sekuru there who can treat the disease. He will just cut the affected part, then everything will be okay. I thank God that my mother was saved by then. She didn't believe in Ngangas. So she just said, no, I just decide to believe the medical side, the medical report. So she opted for the amputation, and then took my uncle to explain and trying to convince me so that I could get the amputation. So after some days, I then agreed, but I had not accepted. It was just agreeing to say, parents are just saying, just go for this is good for you. So I agreed, not because I had accepted or I understood exactly what was happening. I didn't. So went for the amputation, and the doctor told me that I had to go through a lot of tests because they wanted to find out if the disease had not spread to other parts of the body. Otherwise, they could amputate me the leg, and the next thing it was the hand. So they wanted to find out first whether it had not spread to other parts of the body. And after all the tests that I went through, it was discovered that the only affected area was the knee. So my orthosurgeon told me that he was going to amputate me above the knee. Wanted to make sure that he get rid of the affected part completely. So I went through the amputation. That was after a month now, and it wasn't easy, but surprisingly, the first day from the theater, I felt relieved. The pain was gone. I couldn't feel any pain except the pain from the operation. I could feel that something has been lifted from me. It was really painful. I couldn't sleep for the past 2 months. I had sleepless nights because of the pain. It was just severe. But people were coming to see me, felt pity for me. Some were crying, just watching me. You no longer have a leg. All this time you grew up with both of your legs, but now the other leg is gone. To me, fine, it was still affecting me that I had lost my leg, but I was relieved that the pain was gone. So I was advised that after the amputation, I would be going for chemotherapy, the drug that they administered so that the cells, if they were remaining cancer cells, they could get rid of that through the drug. So I went through chemotherapy for 6 months. After amputation, I was in the hospital for close to a month because they had to wait for the stump to heal, and I had to go. I was discharged after a month. After that, I had to come back for my chemotherapy sessions. I had them for 6 months. The first month, for a week, I would be admitted in the hospital, and it was a bad experience, though it was really helpful.
The message is to say everybody should be aware of this particular dreaded illness. Having said that, when you know you've got a strong family history of cancer, be screened early, be checked. When you suspect you've got abnormal growth, abnormal lumps, abnormal pains, go and be checked. When you know you're immunosuppressed for any reason, be it because of HIV or use of drugs or any other reason, go and get checked. Cancer can affect anyone.